So to introduce our first keynote speaker for the day, Daniel J. Kruger earned his PhD in applied social psychology at Loyola University, Chicago, where he received specialized training in survey research. He gained practical experience as a door-to-door interviewer in Chicago neighborhoods for a NIDA-sponsored drug use surveillance project. Then he completed an NIMH postdoctoral fellowship in psychosocial epidemiology at the University of Michigan's Institute for Social Research. Following the state-level establishment of medical cannabis programs, Dr. Kruger and his collaborative team began a research program on the medicinal use of cannabis and its relationship with mainstream healthcare systems, including collaborations with medical cannabis dispensaries. Following the surge in general interest in psychedelics, including clinical trials suggesting legal availability of psychedelic therapy in the near future, they launched a community-based collaborative research program to advance knowledge and provide data-driven guidance for appropriate public health policy. Today, Dr. Kruger will be discussing advancing the understanding of naturalistic psychedelic use. What do we know and what do we need to know to establish a comprehensive health framework? And if you'd like to ask a question at any time during this talk, please enter them into the Q&A function. Without further ado, let's give a warm welcome to Dr. Kruger.
Thank you, Maya. Thank you, Kiki, and thank you all the other IPN organizers. I appreciate that you're here on the third day of the conference after seeing some really wonderful sessions for a couple days, and for all those who are watching virtually after the conference. So are you guys seeing the full screen view here?
Yes, we can.
Okay, it's not in presenter mode?
No, it's not.
Okay, great, wonderful. Well, thanks everyone again.
I'm seeing it in presenter mode, so you'll have to make it full screen.
How's that?
Perfect.
Wonderful. Well, thank you everyone. And I'm going to be, giving an overview of the state of psychedelics in terms of the broader health framework. What do we know now and what do we need to know to establish a really comprehensive health framework? And, since you're probably familiar with psychedelics, especially after the last couple days of sessions, I'll give a brief overview of where we are. So psychedelics are both ancient and cutting edge. We know that they've been used for thousands of years in, certain indigenous cultures for various purposes, and are now thought to be possibly the next generation of psychiatric medications. So people are very excited about their potential, and we see a lot of research in the early to mid 20th century on different psychedelic compounds and their potential for therapeutic use in mental health conditions, for addiction and substance abuse. And there was a lot of really promising research and promising results, although in the late 1960s psychedelics became criminalized and activity went underground. So most psychedelic research ended, especially most institutional research, most above ground research, and most of the therapy that was being done and conducted in institutions dissipated. But people did go underground, and there continued to be people who are working in psychedelic therapy and research, but largely disconnected from the larger system. So that's an issue we'll talk about. Now we're experiencing a so-called psychedelic renaissance, and there's been a revival of research in the past couple decades, and really kind of an explosion of research just in the last few years. There's also increased use of psychedelics, especially amongst older adults. There's some indicators that psychedelic use, especially in certain populations, is at all-time highs in the population. So this is becoming greater and greater factor and issue in society. And we've seen efforts at decriminalization, both at the state level and country level and municipal level, although this is very patchy at the moment, and some initiatives have succeeded, some have failed, and some are still ongoing. So this is something that's again, rapidly changing conditions. And we've seen the emergence of legal psychedelic therapy in certain municipalities, states, certain countries. So this is at the very beginning in many places, but it's starting to become established, at least in some places around the world. And all these factors just contribute to the general excitement amongst the general public for psychedelics, and thus makes it even more important to address these issues. But there's little coverage of psychedelics in the current health and medical education. What coverage there is tends to group psychedelics in with drugs of abuse and just treat it as one of these things that people might want to watch out for and screen for adverse effects. But there's virtually nothing on the current world of research or even the traditions of therapy. And there's scarce information on naturalistic psychedelic use. So there's a lot of money, a lot of investment in clinical trials that are designed to bring psychedelics or psychedelic derivatives to the market as pharmaceuticals. So within medical pharmaceutical model, and these clinical trials are ongoing. There's hundreds of them, and there's hundreds of people involved in them. But at the same time, most people, the vast majority of people who are using psychedelics outside of these clinical trials or outside of even the legal therapeutic environment. So, what is going on with these folks? It's a real challenge to know, because this is something that's illegal, and people might be reticent to talk about their psychedelic usage. So it's something where we need research on understanding, how people are using psychedelics for treating health and medical conditions. And then also, what is the relationship between the therapeutic use of psychedelics and mainstream healthcare? So, again, we're seeing similar trends with what happened with cannabis. Cannabis went through a long period of, prohibition, and then also very rapid first medicalization and then legalization across many states in the United States, and then countries like Canada and other places around the world. So we're seeing similar trends to cannabis, but it's happening a lot faster, and the sort of players in the psychedelic sector are somewhat different from those in the cannabis sector, uh, especially with the large pharmaceutical companies and other folks that are looking to bring pharmaceutical products to market. So a general public health framework, public health has this very practical, almost utilitarian mission to maximize people's health benefits and minimize costs, risks, and harms. It's very idealistic, and at the same time, it's a human enterprise. So there's human factors involved, and there's a lot of politics and political ideology in public health from various perspectives. But at the same time, most people who go into public health because they want to help people, they want to make the world a safer place, and to keep people healthy. So there is a lot of a lot of potential and a lot of potential synergy in engaging with the field. And public health takes a very broad perspective, ranging from the individual level to the policy level. So, working at the individual level, people's knowledge, attitudes, and beliefs, at the interpersonal level. So this could include, psychedelic therapy, organizational level, the community level, and the policy level. So across all these different levels, there are different public health activities and initiatives, and it's intended to be a very, very comprehensive framework. So thinking about this framework and thinking about how would this relate to psychedelics, Well, we have to create this framework for psychedelics, but we do have previous previous models to work with, and we can kind of think of psychedelics as what would you want to have in place in order to ensure the safety of the food supply or the supply of medicines, and apply these frameworks to psychedelics. So. So we want to think about issues at different levels. So first, the substance level, we have the safety of various substances, and there is a pretty wide variation amongst psychedelics and also substances that are psychedelic adjacent or sometimes considered psychedelics by some people. So there's a pretty wide variety. So when I'm saying psychedelics, it actually refers to substances sometimes that have quite different properties and effects. And we want to know things about safety of these substances. So for example, there's a concern that combining psychedelics with monoamine oxidase inhibitors, one of the forms of antidepressant medication, could lead to serotonin syndrome. Basically, some very dangerous conditions. So there could be drug interactions and also contraindications. So people who have a family history of psychosis, there's other factors involved that might be risk factors that we really want to advise people against using psychedelics. Also, we want to ensure a safe supply. I mean, think about all the work that goes into having safe supply of food and medicine across the supply chain. And this is something that would be necessary for psychedelics as well. And we would want to know optimal dosages for specific purposes. So, right now, there are clinical trials that are using, various dosages, but to what degree can people using psychedelics naturalistically, know what doses, they would optimize the results, and how well would they be able to titrate them? So think about if you went to the pharmacy and you had a medical condition you were going to treat with some pharmaceutical drug, and the pharmacist just hands you a bag of pills and says, here, just take these, and just, well, how many should I take? How often should I take it? Well, just keep taking them until you feel better, right? That's not a very systematic approach. So this is something that we'd want to know for psychedelics as well. Also, the emergence of legal psychedelic therapy. This is something that is a brand new and brave new world, and there's a lot of a lot of work that will have to be done to really optimize this, because there's been a big separation between what's been going on in the psychedelic underground and mainstream psychotherapeutic approaches and mainstream systems. So right now, there's not a lot of connection between these systems, and it would be good to have greater coherence. Also, at the individual level, attitudes, knowledge, and misconceptions. So one thing we're interested in is just how much do people know about psychedelics? And there's quite a few surveys now about attitudes towards psychedelics, and attitudes in general are mixed, of course, overall, but are becoming more and more favorable, especially in younger generations. So that's something that a trend we should be aware of. And at the same time, there's a lot of misconceptions about psychedelics because there's been a history of misinformation and rumors, and honestly, this is dangerous for a number of reasons, but one of the possible dynamics is that people are told all these horror stories about psychedelics and what they could do, and then they might experience them or their friends experience them, and they think, oh well, it was all wonderful, those were all lies, and then they might not be as receptive or attuned to messages or information about the real risks and dangers of psychedelics. So the pendulum could swing too far to the other side. Also, we do want to know more about acute and persisting adverse effects. This is something that is becoming a research topic in the psychedelic research community. So people do know about this and are documenting this, but much more needs to be done. And also, what are the best practices? What are the best practices for using psychedelics? There's a lot of kind of catchphrases and things like turn off your mind, float downstream, and surrender to the void. Catchphrases that people, with considerable psychedelic experience might relate to. But what does this really mean? For someone who has never experienced psychedelics and is going to use them for the first time, what would you practically do? And how do you deal with situations, especially dealing with adverse effects? So this is something where more work needs to be done. Also, the interpersonal level, so communication with healthcare providers, this is an issue we'll talk about, and best practices for psychedelic assisted therapy, it's another issue to cover. Also, social stigma, so we still think there's a lot of stigma against the use of psychedelics, even for the use of them therapeutically. There's organizations that have been working on this for decades, and we might be seeing shifts now, but it's something to keep in mind. Also, at the organizational level, we want accurate information in public media. The media kind of has a tendency to raise the alarm and get our attention, and you know portray a story in a way that's captivating. It's going to capture our attention, and thus a lot of media these days is really sensational. But we really want accurate information and balanced information in the public media, because that's one of the forms of consumer education. Also, training of health professionals, an issue that we'll address here, and education for the general public. So this is something that the Before You Trip program is starting to work on, and there's other efforts around the world that are just starting to reach out to the general public to give them a better understanding of psychedelics. Also, the accessibility of psychedelic therapy, both in terms of the legality and cost, is an issue. And again, a safe supply chain of psychedelics, so people know what they're taking, they know that they're safe, and they know how much they're taking, importantly. And regarding public policy, psychedelics are still considered Schedule I substances in the United States, and they're still prohibited in most other countries around the world. And there's a big process of FDA approval and regulation that you hear about in terms of these clinical trials. So now there's more phase 3 clinical trials, which are the latest before something gets approved as medication. So these are on the way. So we expect to see FDA approvals. You know, we don't know how soon, but in the near future, we think that some of these will be approved as medications. But right now, there's a patchwork of regulatory environments. Can vary, both country by country, state by state, and then even within states, certain municipalities have decriminalized, some have not. Even when states have a statewide plan, there's municipalities that can opt out. So there's a lot of a lot of differences across geographic and municipal regions. Okay, so how do we address some of these issues? Well, we launched the Psychedelic Community Survey, and this is a community-based approach to psychedelic research. So it's a collaboration with the psychedelic community, including academic researchers, psychedelic therapists, psychedelic enthusiasts, and psychedelic activists. So it's coming out of models, related to community psychology, public health, and other community-engaged fields. And the goals are to document the knowledge and experiences of the psychedelic community, to enhance the quality of research, increase public trust in results, and amplify the voice of the psychedelic community in shaping the future of psychedelics. Okay, how do we do this? It's an anonymous online Qualtrics survey. We do not collect any metadata, so it protects participants. Items are designed with the team input, and we recruit in person at an event called EntheoFest in Ann Arbor, Michigan, which is a psychedelic advocacy and education event, and psychedelic related email listservs and newsletters, and on social media, and researchers contact networks. Of course, this project is hosted, in a university, and it's reviewed by the University of Michigan's Institutional Review Board prior to data collection. And we have several waves of data. So I'll be presenting data from several different waves, but I'll give you an overview of the methodology. We have I think a decently representative sample of psychedelic users, of who uses psychedelics, combined with who is likely to complete an online survey. So we do tend to have a bias towards people who are of higher socioeconomic status, and white versus non-white, but we do have a good distribution across age, gender, and other characteristics, and we have a very large sample. This was at the time this was the largest and most comprehensive net survey of naturalistic psychedelic use. So what psychedelics do people use? Well, psilocybin was the most common. Over 90% of participants had used psilocybin. About three-quarters had used LSD. A little over half have used MDMA, MDA, Molly or ecstasy. And then about a third had used ketamine and DMT, followed by, other compounds, mescaline, 2CB, other research chemicals. And, finally, very small portion at this time had used ibogaine. And people vary in terms of the frequency of use. So the modal use, was once every 2 to 5 months. So, sort of an occasional thing. Although there were people that used, only once in their lifetime, once per year. And then also people who use once a month, once every week, or more than once per week. Although some of these people who are using psychedelics really frequently could be microdosers. 9% of the sample only used psychedelics as in microdoses, and the rest used either high doses or both microdoses and high doses. The settings that people use psychedelics in, most of them had used psychedelics in their home or outdoors in a natural environment. About a third had used psychedelics in somebody else's place, and then less so outdoors in a natural environment at a retreat. But notably, only about 3% in a clinic or hospital. So these are, very, very small portion of psychedelic users are using them in a structured, regulated environment. And again, most people have used psychedelics with other people, although about 40% have used psychedelics while alone. But people have used psychedelics across different social contexts. Everything from microdosing on a normal day, to being with a group of strangers. And again, low numbers for people who are using psychedelics with therapists or health professionals. Motivations, there's a lot of different motivations that people have for using psychedelics, and people could select all that apply. So the number one reason was for spiritual, psychological, personal exploration. Also, personal growth was a large factor for about three-quarters of people, and about two-thirds of people just said fun. It's recreational, it's fun, it's enjoyable. And at the same time, almost two-thirds said that they use psychedelics to improve their mental health, and many said that they use psychedelics to manage past trauma, treat a medical condition, reduce their use of prescription medications, and reduce other substance use. So what you see here is a mix of recreational and therapeutic use. Even within the individuals might have multiple motivations. So we explored this further, and we found that, we asked what initially motivated you to use psychedelics in one of our later studies, and found that people who use psychedelics for the first time in their adolescence, so when they're less than 20 years old, were more likely to endorse, curiosity, fun, as an escape, social peer pressure, or boredom. So sort of recreational motivations or peer motivations. And those who endorsed using psychedelics for the first time in adulthood, and we just split this up to be 20 years old and older, were more likely to use psychedelics for spiritual exploration or growth, to improve their mental health, connect with nature, improve or enhance relationships, treat a mental health condition, manage past trauma, manage current trauma, reduce the use of prescription medications, reduce the use of illicit substances, or treat a physical health condition. So we definitely see this shift towards therapeutic use. And there's a similar shift in motivations from curiosity and recreation to therapeutic use across participants' current age. So a lot of participants, reported that, yeah, I started using psychedelics recreationally. I was curious. It seemed like fun. But then once they experience psychedelics, maybe they see the healing potential and they're using them more so therapeutically. And we're seeing this shift, from initial motivations to current motivations, as well as across participants' current age. Okay, so let's take a look at therapeutic use. For about half use psychedelics to treat a medical condition or manage trauma. About 2/3 use psychedelics to improve their mental health in general, but only 3% use psychedelics in a clinical or hospital setting, and only 4% use psychedelics with a therapist or healthcare professional. The conditions that people treated tend to be mental health. So here's one of the interesting contrasts with the medicinal cannabis use, which includes both mental health and a lot of physical, health conditions like chronic pain, uh, more prominently. Depression, anxiety, PTSD were the top conditions that people used to treat with psychedelics, as well as other things like addiction, ADHD, um, OCD. And some people did use psychedelics to treat chronic pain or other conditions, but not as many physical health conditions as with cannabis. So it tends to be more utilized for mental health conditions. And then there's actually a range of effectiveness in terms of self-reported effectiveness of psychedelics for treating different conditions. We do see a real range here. Uh, PTSD, depression, anxiety, addiction. Most people said that their outcomes were better from the use of psychedelics, but you definitely see a range where it goes down to about half of people using psychedelics for ADHD said that their conditions improved, and half said that there was no change or they were worse. And then for sleeping disorder, only minority said that psychedelics overall improved their conditions. But we do see this potential, and again, these results, this effectiveness is also largely outside of a therapeutic context, and we have reason to believe that when psychedelics are integrated with therapy, that they could be even more effective. We also see substitution. So people who are using psychedelics are reducing considerably their intake of substances like alcohol, antidepressants, cocaine, tobacco products, benzodiazepines, which are anti-anxiety medication, amphetamines, opioids, both prescription opioids and illicit opioids. We see kind of a mixed picture for cannabis. So we also let people say that they initiated use of substances or increased use of substances, and you see a little bit of that here, especially with cannabis, a little for tobacco products, but at the same time you see more substitution where usage of these other drugs is going down. Also, we want to be aware of challenging experiences with psychedelics. So we asked about these specific forums, and found that about 8% of people knew someone who was the victim of inappropriate sexual contact by a psychedelic sitter, guide, or practitioner. About a third of people knew someone who was arrested for the possession or use of psychedelics, and about a quarter of participants knew someone who experienced a severe adverse event because of the use of psychedelics. And out of those people who experienced a severe adverse event, so we asked, did this person who experienced the severe adverse event have guidance from someone who was knowledgeable at psychedelics, before, during, and after the experience? And only a minority of people did, about um, around a third before and during the experience, and a little less than half, afterwards. And we kept this is a very generous definition. Someone who is knowledgeable about psychedelics could just be another person who has taken psychedelics. It wasn't necessarily, a trained therapist. So, these numbers are quite striking. Also, those were, sort of more severe conditions, but there's also a lot of adverse or uncomfortable experiences that are common in the use of psychedelics. So you can see, being frightened, sadness, feeling your body shake and tremble. This it's not always happening, but if you look across people who have said that this happened to them, anywhere from rarely to always, about three-quarters said that, yeah, sometimes I'm frightened when I'm on psychedelics. A little over half said that, I feel sadness. About half say they feel their body shake or tremble, or experience isolation or loneliness, experience panic, despair, fear that the state they're in would last forever. So again, these experiences are fairly common and something that people should be aware of. Might happen, and we want to know, like, what is the best way to deal with these situations, especially in a naturalistic environment, and one where people don't necessarily have any official structure for support. Okay, testing of substances. This is an important issue. About two-thirds were aware of laboratory testing services or home test kits, but of these people, only 14% always tested before consuming. 43% of people never tested before consuming. And overall, 64% were either unaware of or never used testing. And this number is similar to what we see, across studies, two in the U.S. and one similar one in Canada, where it looks like there's even lower rates of testing psychedelic substances before they're used. So this doesn't happen most of the time, and that could be concerning. We also asked, how important is it to have a trained therapist or healthcare professional during the use of psychedelics for therapeutic purposes? And again, this is for everybody. Everybody who's taking the survey is answering this question. And there's a range of perspectives. There's a range of opinions on this. But then we asked, if you've consumed psychedelics with a trained therapist or healthcare professional, and 15% did in our 2022 wave. So then we asked these people, how important was the presence of the therapist or healthcare professional to the success of your psychedelic experience? And about half said very important, and about a quarter said important. So about three-quarters said that it was important or very important. And we see favorable likelihoods of using therapeutic support if legal. So in both the US and Canada, we see the majority of people are very likely to use therapist support if it were legal, and more even if you combine likely and very likely. But at the same time, very few people disclose their psychedelic use to their primary care provider. And this is problematic for a number of reasons. Um, and we see across, the two studies in the US and one in Canada, it's about 20%, across the board. So this proportion is very low. People are not telling their primary care provider about their psychedelic use. Well, why is this the case? There's a lot of different reasons for non-disclosure of psychedelic use. There's a social stigma. Um, People don't think that their provider is knowledgeable enough about psychedelics. They're worried about the legal consequences. they want to keep it private. They say, well, there's no reason to discuss it. Don't bring it up. It's just, it could cause more problems, than it's worth, and lack of trust in their provider. So there's a lot of different reasons. So let's take a look at this relationship from the other side. Let's look at the training of health professionals in a different kind of survey study. And we asked people who are master students in health profession or biological sciences, medical students, so MD students, and people who had completed their medical doctorate and were now residents and fellows. So doctors, going through the residency or fellowship before they become independent practitioners. Have you heard of psychedelics in medicine or psychedelic assisted psychotherapy? And most people have. This is now something that it's discussed amongst the people who follow the news and follow modern trends. So most people are aware of it. But have you received any training or participated in any group learning in psychedelic science, medicine, or psychedelic assisted therapy? And what we see, these numbers are really low. And we were very generous with our definition of training. This could even have been watching a webinar. So if somebody sees this presentation, they could count it as, oh, I had some sort of, psychedelic instruction. So very low, especially for people who are, going into the medical profession. But what we see is that even people who are very, very early in their careers, patients are asking them about psychedelics. So, about 1 in 5, almost a quarter, um, you know, MDs who are now residents or fellows are being asked questions about psychedelics. And this will probably increase, over the years. But do they feel competent to provide advice on psychedelics? Almost all say not. No. So only about 5% of, the master's students or residents and fellows said that they felt competent to provide any advice on psychedelics, and none, absolutely none of the medical students felt competent. But at the same time, people are interested, so there is a range of interest, there's a distribution of interest. But most master's students and about half of medical students said that they'd be extremely likely or somewhat likely to obtain training in psychedelic assisted therapies if were available. So a lot more people are interested in this than have received any kind of training. So if people are not going to their primary care provider, not going through the standard healthcare channels for the information about psychedelics, where are they getting their information on psychedelics? So this is an area we've studied as well. And most of the time, people's information from psychedelics is from their own experimentation and experiences. So just personal experience, followed by about 2/3 of people said, from the internet or from friends, internet discussion forums. Some people read books. Surprising number said that they read articles in peer-reviewed scientific journals, although you can get these on the internet now. So, you could do a web search or, use Google Scholar and oftentimes get access to articles. Um, and many looked at social media and podcasts, information from nonprofits. But if you look, you see only about 20% said that they had information from psychedelic therapists, and only about 5% said that they got any information related to psychedelics from their primary healthcare provider. And notably, only 2% said, I do not seek out psychedelic information. So most people are, and the different colors here indicate significantly different proportions of participants. So you can see the effects as it goes down. Same for these following charts. How much do you trust information on psychedelics from these various sources? What's nice for researchers, for academic researchers, people trust articles in scientific journals very much, as well as information from psychedelic nonprofits and researchers based in universities. Still, it's notable that, on average, people trusted these sources very much. There was no source that was trusted completely on average by psychedelic users. And there was less trust in your researchers in industry or psychedelic therapists operating independently, much less trust in just anybody posting on the internet or articles in the popular media, psychedelic startup companies. And the lowest amount of trust we saw was for government agencies and pharmaceutical companies. So, pretty interesting pattern here. And we did an assessment of psychedelic knowledge. So this is psychedelic knowledge amongst psychedelic consumers. So people had psychedelic experience. And long story short, their accuracy did vary by the topic. Knowledge was generally good, as about 78% on average, but there was considerable variation. And you can see the spread of how many questions people got right down at the bottom. So only only about 6% got every single question right, and there was considerable variation. And then within our sample, again, these are people who have psychedelic experience. Higher psychedelic knowledge was predicted. Higher psychedelic knowledge was predicted by the number of psychedelics used. So people who had used more psychedelics had more knowledge. People who had more education had more knowledge. Younger people, interestingly, had more knowledge. People who use psychedelics more frequently had more knowledge. And then being male, using psychedelics in high doses, being Caucasian and white, and having higher household income. These are all uniquely significant predictors of psychedelic knowledge. So, I mean, it shows you, how we can custom tailor educational efforts for improving psychedelic knowledge in other communities. Okay, and then, last but not least, let's take a look at psychedelic policies, and let's see, what does the psychedelic community prefer in terms of psychedelic policies. So we first gave people a definition that we called from multiple sources. So we integrated these sources and gave people definitions of legalization, decriminalization, medicalization, and the current federal laws. And then we asked, which of these do you support? And about three-quarters supported legalization and decriminalization. About half supported medicalization, and only about 2% supported the current federal laws. So you can see statistically significant differences based on the color of the lines here. So this is what policies would you support? And then we also asked, if you could choose only one, which would you prefer? And the majority said legalization, although there was, almost a third that said that they did prefer decriminalization to legalization. About 10% preferred medicalization, and very few people had other responses. And it's interesting because we can look into the backgrounds of folks and see how their roles and professional roles and backgrounds might shape these different preferences. But would you support individuals being legally able to do all sorts of different things? This is a way to sort of deconstruct the different elements of psychedelic policy. So the greatest support was for people possessing psychedelic plants or fungi. So people completely supported people being able to possess psychedelic plants or fungi and to grow their own psychedelic plants or fungi for personal consumption. And then very much supported people being able to gift psychedelic plants and fungi to others. Um, and less so down the list, but also sell psychedelic plants and fungi as individuals, not as corporations. That's something our community partners were very interested in. Um, and then, still considerable support, but less so for, possessing synthesized chemicals, synthesizing their own psychedelic chemicals, gifting chemicals to others, and then synthesize chemicals as individuals, not corporations. So selling them had the lowest amount of support. Oh, and then to what degree would people support various practices? So the highest support was for people using psychedelics for religious rituals or spiritual experiences within a group setting without any required fees, as well as therapists administering psychedelics during guided therapeutic sessions. So people supported those completely. There was less support, but still very much support for caregivers who can provide psychedelics to patients without medical authorizations. Then psychedelic dispensaries with legal sales, similar to cannabis dispensaries. A little less support, but still very much for healthcare professionals prescribing psychedelics for use outside of healthcare settings. And then there was still very much support for regulations on testing and standardized quality control and psychedelics used for non-religious, non-spiritual experiences within a group setting with fees required. So certain forms of retreats. Although there was moderate support for healthcare professionals administering psychedelics without therapeutic support, and people only somewhat supported companies obtaining patents for novel psychedelic products, and the lowest amount of support for companies obtaining patents and exclusive rights for specific uses of existing psychedelics. Okay, to summarize these patterns, there was highest trust in academic research and psychedelic nonprofits, lowest trust in government agencies and pharmaceutical companies, and the trends of support were for natural over synthetic substances, for self-production and consumption over gifting, and gifting over sales. We also see more support for guided therapeutic sessions than for medical provisioning of psychedelics without therapeutic support. And concern overall for the pharmaceutical model of psychedelics. So, to conclude, more research and education is needed at all levels. So, we're at the very beginning here in terms of establishing a comprehensive health infrastructure for psychedelics. And we need more research and education at all these levels, ranging from the individual through the interpersonal, organizational, community, and policy. So we're working on this now. So we're looking at the results that we have now, and we are pushing, we're exploring these issues in greater depth. So we're actually collecting data right now for our 2025 psychedelic community survey. So please scan the QR code. You can enter your email, and that goes directly to me, and I'll send you the survey. Again, the survey is anonymous. We don't collect any personal information, and we don't collect any metadata. So no IP addresses, no geographic coordinates or anything. And it's IRB reviewed, of course. Also, I presented data and results from a lot of different projects and papers. You can find these on my website. And if you need access to any of the papers, feel free to contact me directly. That's my email address, kruger@umich.edu. And I'd be very interested to hear, any feedback that you have on this. So, thanks again for your time and attention, for hanging in there on the third day of the conference, or whenever, wherever you're watching this presentation. I wish the best to you. So it looks like we have a few minutes for questions.
Okay, so we do have a question for you. So Daryl is asking, can you see a problem with these terms legalization or decriminalization of substances, as his words convey an abstract binary? Of course, drugs cannot be legal, or criminal. These are shortcut figures of speech that negate quality of treatment and fail to reveal the regulatory sections over activities. So does the speaker accept that we could use correct legalese to better effect?
Yeah, there's a lot of different perspectives on this issue, and there are people who argue that you can't say that a substance is illicit, and we're recognizing all the different nuances of this, and even the fact that, decriminalization could mean different things in different places. So, to go back to the slides, that's one of the reasons why, first we gave people the definitions as best as we could, and we assessed people's responses, based on, those very, 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 very categorical definitions. But then we also asked about specific aspects to go in deeper to see what does it seem that people really want. And what's interesting is that we do actually see a little bit of a contrast in terms of, we see, if you just look at preferences for, legalization versus decriminalization, it looks like more people support legalization. Well, why is that? Well, maybe because, with decriminalization, the laws are still technically there. It's just that law enforcement can, choose not to enforce them, or they're considered a low priority, but they're still there. It's still potential, and maybe legalization would be safer overall. But then if you look at the patterns of preferences, people actually, if you look at the specific aspects, they're more sort of consistent with an environment of decriminalization rather than full legalization and psychedelics being sold as commercial products. So, that's one of the reasons. I mean, that's one of the ways in which we addressed this issue. So thank you, Daryl.
Yeah. And thank you for your lovely answer.
I think we did have one more question. Dr. Kruger, given that there are limited universities with psychedelic therapy or research centers, what advice would you give to students who are interested in this work but may not have access to these institutions?
Mhm. Well, there are conferences and online conferences like IPN, which are very accessible. You can also, look at talks from other conferences. So Breaking Convention has a lot of videos from previous conferences that are online. The MAPS conference, Psychedelic Science, and others. So you can learn a lot, just from watching these videos on the internet. Although, be selective, because a lot of these are from, reputable sources, right? So I would tend to prefer the folks who do have, the research and educational backgrounds, and, can present, empirically supported evidence. So a lot of these folks are giving presentations that are, available online. And at the same time, you could go to these conferences yourself. You could contact the researchers, contact the people. Yeah, there's limited places and limited positions, but, if you reach out, I think you'll find that, people, may be receptive and engaging, and may be able to give you advice to at least get the next step along the way.
Okay, thank you so much, Dr. Kruger, for your thought-provoking presentation. And your work is very inspirational to the members of IPN.
I appreciate your appreciation.